Okay, so for this question, we have a 48-year-old man who presents to the clinic after returning from a 2-week business trip to a developing region. He reports persistent watery diarrhea for the past 4 days with up to a dozen bowel movements per day. The stools are loose, non-bloody, malodorous, and vary in color between light brown and green. He also complains of abdominal bloating and excessive gas. He has been taking over-the-counter antidiarrheals, but they have not improved his symptoms. He denies any fever, nausea, or vomiting. On examination, he appears well, with normal vital signs and no signs of dehydration. Abdominal palpation reveals mild tenderness and distension, but no GERD or rebound. Bowel sounds are present and active. FOBT is negative. Which of the following pathogens is most likely responsible for this patient's condition? All right. So if we're just going through the questions, you want to pick certain things. Usually I try to always look for the gender of the person. It's not that important in this question, but in most questions I just highlight the age of the person and the gender of the person, right? So a 48-year-old man, right? He went on a business trip, so that's important, particularly if that business trip is to a developing region. So he probably picked up something, right? Okay, the diarrhea is watery. So that's super important when you're doing diarrhea questions. You want to see if it's watery or bloody, right? So you want to tell if it's an inflammatory kind of diarrhea, all right? The color of the stool as well could be important, right? But not necessarily for this question. He has no fever. So again, this is not systematic, right? So that's super important. All right. Now, the answer for this, by the way, is ETEC. Okay. So remember, if you've got a question of someone going to South America, it's kind of stereotypical, right? So a stereotypical developing region, ETEC is a pretty good option, particularly if there's no inflammatory diarrhea. So remember, this is the organism that has the heat stable and heat labile, right? So it's right here. So heat stable and heat labile toxins, right? So the heat stable is one that increases cyclic GMP, right? So if you remember the mnemonic stable on the ground, right? And then heat labile increases cyclic AMP, right? So that's how you're going to accumulate all the water in the gut. Okay. Now if we just go through the other options, Campylobacter jejuni. Just change colors here. So Campylobacter jejuni. Remember, this is the one that is linked to poultry, right? So undercooked poultry, right? And unpasteurized milk, right? So unpasteurized milk, right? Now the important thing to know about this one, particularly when it comes to step questions, is the link between this and Guillain-Barré syndrome. Remember, this is the ascending paralysis, right? Kind of difficult to treat, IVIG and stuff like that, right? So that's the link with this one. So there's a spool right here, right? So Guillain-Barré syndrome, okay? C. diff. C. diff is under favorite one of theirs. So with C. diff, remember this one linked to the use of antibiotics, particularly if you see clindamycin, right? Clindamycin being used in a patient, and then they then have diarrhea, very watery diarrhea, then there's a chance that they have a C. diff infection, right? Super malodorous, okay? And remember, it's linked to the pseudomembranous colitis, right? So pseudomembranous colitis, just put PC right there. Okay, so you treat with vancomycin or metronidazole. Okay, Entamoeba coli. Now, this kind of a red herring. They might be trying to trick you into thinking it's maybe Entamoeba histolytica, which is also an option here, right? But Entamoeba coli doesn't really do anything, so that's out. Okay, Entamoeba histolytica, right? So this is the one that causes the bloody diarrhea. It will give you a fever, right? So it's systemic, and you treat with metronidazole, right? So this one is out as well because it's a bloody diarrhea. Non-typhoidal Salmonella species. Now remember, the typhoidal one gives you that pea soup diarrhea, right? And then the other one gives you an inflammatory bloody diarrhea. So that's out because, again, this patient has watery diarrhea. So this is out. Norovirus. This is the one that you're going to link with cruise ships, all right? So cruise ships. Okay, so it's going to give you a diarrhea, watery diarrhea for a few days. It usually resolves on its own, but it's also going to cause vomiting. So that's kind of important. So vomiting. Rotavirus, right? So again, we highlighted the age of this patient at 48. Rotavirus goes for basically toddlers. All right. So you're looking for a very young child. Young child. And it's usually like during the winter months or stuff like that. All right, so just remember that Shigella will give you that dysentery, right? So dysentery. Okay, and it's definitely a bloody diarrhea. Yersinia enterocolitica. This is the one that causes that pseudoappendicitis, if you remember correctly. So pseudoappendicitis. All right. Now that's just pain, usually in toddlers, usually from eating pork. That's not cooked well. All right. So again, just go through the thought process. So usually, again, when I'm answering questions, I start with the question at the bottom, and then read the whole thing and try and highlight through the important things. All right. So catch you in the next one.